I'm giving you facts here, right? That she ain't gonna come. Okay? You will, but she ain't. So
Cute.
very cute. And portable.
Let me see. Can I I was gonna say, can I fit in my scrap pocket? In my scrap pocket. Okay. Lonely calls.
People don't realize is that a vagina smells.
Hi guys, and welcome back to another episode of ziRight Girls, where we discuss everything girly and gynae. So this week our episode is a little bit different. We're doing a round table. So we've invited a few friends and special guests to help us discuss things around women's reproductive health. Alongside me here is Dr. Maurice O'Brien. So she's come all the way from KZN to be here today, and she's an obstetrician and gynecologist with a special interest in menopause. Over there we have Dr. Halima Adey, who is also an obstetrician and gynecologist with a subspecialty in gynae oncology. So she specializes in gynecological cancers. And then you know myself, Dr. Thalia Isaacs, and I'm here with Dr. Masina. Okay, so we're going to be playing a few games today, and the first game aims to get to know us and know each other. So we're going to be exploring, our backgrounds. The name of this game is called Two Truths and a Lie. So you tell us two truths about yourself and one lie, and you guys must try and guess which one is the lie. Okay, I'll go first. So I have always wanted to be a doctor. I have two boys, and I love hip-hop music. Which one's the lie?
Oh, I like it. I think you didn't want to be a doctor.
Okay.
I agree.
I also agree, but I think I have an unfair advantage.
So no, you guys are all right. So I didn't want to become a doctor. I was academically strong when I was in high school. And, like back in the time when we started going to varsity, you could either be a doctor, a lawyer, an engineer, or an accountant, right? And of those four, I think medicine was the one that was closely aligned to what I liked. I wanted to be a scientist. In fact, I wanted to be a forensic scientist. I wanted to do CSI.
That's so cool.
Gil Grissom. Big crush. So I wanted to be a crime scene investigator, and then I didn't do biology at high school, so I couldn't get into Technikon.
Oh, okay.
But I was accepted to UCT to do medicine, and that's how it started. I wanted to then specialize in forensic medicine.
Yes.
But before I got to do forensic medicine, I did my rotation in obstetrics, and then I fell in love. I fell absolutely in love. It was the first time I felt like doing something as in med school. Before that, it was all like books and exams. But when we started delivering babies, I could actually see like how I fit into the system and where I could make a difference. The nice thing about obstetrics is like your patients aren't always very sick, and there's like always a prize at the end of it. Like there's this baby that like gets born.
Mm.
So that's how I fell in love with obstetrics and gynecology. I'm not big on gynecology. It's not my forte, but what I love about it as well is that it impacts quality of life. So patients come with a long history of a problem that they've been dealing with for forever, fibroids, endometriosis, or whatever, and usually like we can solve that for them, and they live better lives for it. So that's how I became an obstetrician and gynecologist.
Cool.
Who's next?
Oh, okay. I always suck at these games. So, two truths.
You can't tell us which are the truths.
I'm just
You mix
thinking.
it up.
I'm thinking out loud. Okay. I have two kids. I'm turning 45 in about 8 weeks' time. And my side hustle. Okay. My side hustle is ziRight Girls.
That's true.
So we know one truth.
Okay.
Okay,
figure
you're
out-
definitely not turning 45. So that's the
How
lie.
do you know?
Black don't crack.
Yo, you're not turning 45. You're definitely not.
I have again home field advantage. You're not turning 45.
Yes, I'm not turning 45, but the big 40 is coming up.
It's fun over here, girl. It's fun over here.
I'm not sure if I'm excited or sad, but aging is something that I always feel is a privilege. Every time I feel like, sure, I'm so old, I always think back of some people that you maybe went to high school with that never get to see this age, and it always just hits me with gratitude. But yeah.
That's beautiful, Lee.
That is.
But 40 is great. 40 is
I'm
great.
looking forward to it.
There's a newfound freedom in being 40.
Is it?
I unleashed it when I was 35, girl. I was like, hey, I'm too old to be somebody's.
Until perimenopause is coming.
Friend, I'm looking forward to that too.
Bring it on.
Maybe some of the suffering will end.
Really? To be replaced by a new one.
We can end it. We don't have to wait.
They say a change is as good as a holiday.
Depends on the change.
Depends on the holiday.
True. Who's next?
You wanna go?
Ooh, feeling under pressure. Okay. Two truths and a lie. If I wasn't a doctor, I would have been a dancer. If I live in the hottest part of the country currently. And engineering was actually my first choice.
Oh, that's hard.
Yeah.
That is sort of like got into engineering or was about to be an engineer.
I don't want to destroy the dancing
And
dream.
then medical school was like, I also wanted to be a DJ. So I can't put the dance thing like completely off the table.
I could see you doing like, so you think you could dance like modern vibes, but I feel like I know you a little bit better, and your dad's Ghanaian, so I think the engineering thing might have been like
pushed you that
might have
way.
been the push, yeah. And I know where you live,
Yeah. So the one is easy.
What is easy?
so I think like that one is definitely the truth. Like you live in the hottest place in South Africa. I don't know if you would have been a dancer or engineer. I don't know.
Which is it?
I want to say the lie is the engineering because I really want you to have gone to be a dancer.
Tell us, Ali.
Okay, that's true. The lie is the engineering.
What? True story.
My dad is an engineer, and he wanted me to do engineering like badly. And he used to take us to the office, and he's like, "Hallie, this is a good choice." And I'd be like, "Your job's boring. You can file all day. You talk to no one." So it's a hell no for me. So it was never even on my options.
Oh,
But he would
wow.
have loved me to be an engineer because he wanted, legacy. But my brother did that. He took the engineering.
Okay.
And of course, when you say you want to be a doctor, no parent is ever disappointed with
Yeah.
that. Like, okay, fine. If you can't do engineering,
We have to.
you might as well be a doctor.
Tell us about the dancing, please.
No, I'm just in my other life. If I had to do whatever my heart desires, as much as I love my job, I would have been a dancer.
Friend, you would have fleet.
I would have been a dancer.
You would have been on fleet.
Yeah.
I think you would have done marvelous.
It would have been
So maybe we
good.
should make her dance at the end of the show.
Make it TikTok.
It's late now.
All right, Maurice,
Right,
you are
cool.
up.
Two truths and a lie. I can leg press 110 kgs. I have never been stabbed by a patient. Yeah, that could do. I have always wanted to be a gynecologist.
You see now the stabbing by the patient.
Yeah.
See, that led you off track.
I think that's
I was
the last one.
intentionally
The
trying
lie
to
is
lead
the
you
last
off track
one.
there.
The lie that she's always wanted to be a gynecologist. Yeah, I agree with you.
Which one? Two truths and a lie.
Yeah.
'Cause I'm
And the
also
first one
pressing,
was?
like,
Was I can leg press
above
110
100
kgs.
as
I
well.
feel like that's the lie. That one feels a bit obvious.
it's
but
easy.
I'm looking a little scrawny.
And leg press
She's
is,
strong.
I mean, if you were talking about a deadlift, maybe 110 you could. But a leg press. Oh no, a leg press.
She
is
can
one.
do it.
No, you can do
She
that.
can do
You can
it.
do that. Yeah.
I'm
You
doing
can do
it.
that.
Okay.
So it's
Okay. Let me and my non-Jimsons not judge you. I don't know.
Choose something.
I want to know about the stabbing, so I'm gonna go with.
Okay, just so you can get you can have all the stories. I won't ration you.
I want to hear about the stabbing, so I'm gonna go with it. That's the lie.
Okay, it's not.
Okay.
The lie is that I didn't ever want to be a gynae.
Oh wow.
Yeah.
Okay.
That one definitely fell on me accidentally.
Okay.
I'd always want to be a plastic surgeon, a trauma surgeon.
Okay.
And it was actually during my internship. The patient was ready for a C-section and no one could find the senior doctor to do the C-section. The nurses had to walk me through my very first C-section with absolutely no help at all.
Wow.
And at that moment, they said, you are a gynae, you just don't know it yet.
Oh wow.
And to prove them wrong, I tried to do gynae to say, I told you so, this is not for me. And then I loved it.
Well
That's
done,
one way to
whoever
be
the
a gynae.
sisters are. We give you guys
I would have
props.
been traumatized out of it. Like, whoa.
Exactly.
If this is the support you get, I don't want it.
Yeah.
This is not part of the thing, but like this week I did a placenta previa and like you came up in the conversation. We spoke about it as well. So like I had butterflies in my abdomen. I said to Dr. Sivarigi, who was helping me, like the more you know, like the more fearful you become. And we were talking about like your first Caesar was a previa and you just go in and it's not like that. There's like a whole like plan.
Process.
But this is like what,
That's what happened.
this is where we come from. This is like out learning via trauma.
My
But well
first
done,
Caesar
Maurice.
post-com
But for me, Maurice, what sealed the deal with gynae was the support I got from seniors in the gynae department.
Nice.
Oh, wow.
Because everywhere else, you were like either pushing papers,
Yes.
or you were like an annoying intern.
And you're like,
or
come,
whatever.
come.
Yes,
Let me
but
teach
like
you.
mostly in obs and gynae, you'd get seniors would actually walk you through things, would teach you to do things, would let you actually cut, not like in other specialties.
So I think it was more for calling for me because I don't know why. Sometimes I'm like, why am I here? I want quality of life. But then my mom told me an interesting story that her grandmother, which is my great grandmother, was actually like the village sort of midwife.
Yes.
And she had a specialty of turning breech babies.
Oh.
So she would tell the moms to go and fetch the water from the river early in the morning so it's crisp and it's cold. And then they would lie on, they should put her hands in there and then she would, I don't know, shock the babies to turn or something like that. And I was like, wow. So I've always been interested in sort of alternative, not alternative, but more like what did people do before we formalized the speciality and what can we take from that? Because if you look at how we do it now, it's a maneuver. There's no science per se to it, other than of course excluding things, situations where you don't want to do it. But there's no real science. You're making the baby do a somersault. So that's definitely something that could have been done back then. It's not necessary. So that was for me very interesting that it felt like, oh, okay, maybe
Like
we
a
can
legacy.
continue a legacy of
Well,
some
there you go.
sort.
You found your
Cool.
legacy. Might not be dad's, but it's yours.
Yeah, no, sorry, Diddy.
Cool.
Okay.
Marisa, I think there's some hint of truth in the stabbing story.
No, that definitely happened.
You've been stabbed?
By the patient.
Oh my.
Tell more.
Yeah. So this was internship, Krugersdorp, and I had a patient who didn't speak much English and was admitted as psychosis. So we're setting the scene. And I obviously couldn't discharge this patient. He absolutely needed to be discharged. And at that point, I wasn't, as Jimmy and strong as I am now. So he tried to grab me and punch me and hit me. And in this process, grab my beautiful, strong, big, sharp fountain pen and stab me. Since then, I've stopped using fountain pens at work. But yeah, that was then me going off to casualty and sorting out tetanus shots and all sorts of stuff. But I was fine. But I don't use big fountain pens anymore.
Or deal with psych patients.
Oh no, yeah, gynae still has to deal with a lot of
A
lot.
mental health issues. Yeah, true.
So our next game is going to be Mythbusters. So we're gonna draw out cards and then we're gonna discuss if it's fact or myth. Okay, so I'll go first. Ooh. Okay, we go right into it. Gynaes can test for virginity. Myth or fact?
Who are the gynaes?
Gynaes cannot test for virginity.
Okay.
So gynaes are going to be doing an exam in your genital region, in your vagina, but virginity has to do with somebody having sexual intercourse or not having vaginal sexual intercourse. The gynecologist can only check for whether a hymen is present in your body. How that hymen was removed from your body, that can be all different kinds of ways. It can be exercise, it can be sex, it can be cycling, it could be using tampons or having sex. There are some women who also have hymens that didn't fully develop. And even though they have never done any of those other activities that I've told you, there isn't any hymen remnants visible. So not at all.
So, myth.
So it's a myth.
Cool.
Okay.
And it's unethical.
Yes.
That too.
It violates the woman's right to
Yes.
choose when they have intercourse or not, even if they are young. So we must always respect and
Patient autonomy.
create boundaries, even if it's just parents wanting to speak to their kids about safety and whatnot. So, yeah.
Okay,
You draw.
cool. I will pick. Okay. Intimacy isn't always sex, and sex isn't always intimate.
Myth or fact?
Myth or fact?
Intimacy isn't always sex. True. So that's a fact. And sex isn't always intimacy. That's also a fact.
Correct.
True.
Yeah, because sex can also be forceful, can be coerced, it can be, so penetration is not just always intimacy. Intimacy is about connection and vulnerability. So that's how I understand it.
And
it
there's
can
many
be
ways to
emotional.
be intimate.
Yes,
They are,
yes.
yes.
You can go on a date, and that's intimate if it's just the two of you. You could have, you could lie in bed and watch a movie, just the two of you. That's intimate. Or watch porn, just the two of you. That's also intimate. But you're not having sex.
Or share emotionally. That's
Yes,
also very
which is
intimate.
also
Getting to
intimate.
know each other on a deeper level. That's quite intimate.
And these sometimes are the missing parts in a lot of relationships.
Yeah.
You get patients who come in and will tell you that I had a patient who said she'd been married for a few years and she'd never had an orgasm. And when I was trying to explain it to her, I was telling her that if you're going to focus on penetrative sex, that is how you're not going to have an orgasm, because that's not what it's about for women. It's the intimacy you need to focus on. And unfortunately, that's not really taught, that the intimacy is what will get you to the sexual arousal part where you want to go sexually. And for her, obviously it was a big thing because she thought she was abnormal, because she thought all her friends have had intercourse and having orgasms, having a great time. And the reality is that nobody talks to their friends about that specific part. Everyone will talk about they have sex, but the quality of the sex that they're having, nobody talks about. So there's actually a lot of women who are not having orgasms, but that's because we are using the wrong way to define how to get there.
Yeah.
It's intimacy that we need.
The first time I read 50 Shades of Grey, I was a comserve. And it was wild to me that this woman was ravaged, like, from virginity and had multiple orgasms. And I was
Really?
like,
Okay.
this makes no sense, but okay, we'll go with
All
it.
lies and no truth.
Mythbusters. So yeah, I like that as well. Halima, like, we have to teach women as well. Having conversations like this with your girlfriends and stuff is how you're going to learn about the ways of getting there, because penetrative sex is not always, the way to have an orgasm in females. And speaking to your partner as well. I don't know how you have that conversation, like, a couple of years into your marriage, like now having to teach your husband
So
new
for
things?
me, I actually invite her to come with her partner because I know they're going to be shy to bring it up.
Yeah.
Because I'm not shy about
Yes.
it, right? So I'm going to say sex, I'm going to say vagina, I'm going to say porn, I'm going to say penetration. I'm going to say those words that she feels she cannot say. And if I'm saying it here, then he also understands, right? And it's important because she has to advocate for herself.
Yeah.
And she's not going to feel comfortable advocating for herself without any basis.
Yeah.
So if you create that safety net by starting the conversation, not and showing them that there's nothing, I'm giving you facts here, right? That she ain't gonna come. Okay? You will, but she ain't. So we're here to fix that. And this is what you need to do. Then it makes it so much lighter, and it also allows him to understand, and hopefully allows her to then be able to start the conversation
At home.
when they get home. So, which is why I always like it when a patient comes for a gynae consult, even if it's just a random, because people often say, I'm coming for a checkup. And then I'll start the questions. And then all of a sudden, there's a patient I said, do you have pain when you have sex? And she's like, ooh, just like that. Okay.
Just like
I
that.
said, yes, just like that, because there's nothing to do you. So when you make it relaxed, so even if the visit is not for specifically a sexual problem, because not many people are going to come saying that I have a sexual problem,
Yeah.
but it will come up, right, when you ask the
When you ask
questions,
the right
because you
questions.
ask the questions. And when the partner is there, then you're able to address it, and it stops being an elephant in the room.
Yeah.
So that's why I always encourage patients to come with their partners, and talk, and you just say the things casually, and hopefully then when they get home,
Yeah.
they feel free to, or she feels like she can reference what you said. When
My
they're
doctor
in-
said.
Yeah.
Yeah.
But again, it also goes back to intimacy not only being sex.
Yeah.
Yes.
Because again, a relaxed mind, you've been sharing your most vulnerable self with this person in many different ways,
Yeah.
not only just the physical aspect of it. And surprise, surprise, it may happen, you know.
And that's not the goal always. That's another thing. Because when you have sex with a goal oriented mindset, then you will be disappointed in that you didn't reach that, as opposed to enjoying the process. So there's a lot.
I think also something I've noticed with my patients, a lot of them think that what worked with their previous partner will definitely work. Or if things aren't working out with you and your current partner, they expect you to do what their old partner used to do, and that may not be something you feel comfortable with, or even something that feels good to you.
So it's a learning curve for both of you.
Yes.
Okay.
But it sounds like it's solved by speaking about it.
Communication.
Communication, yeah.
Communication. Okay.
Next one.
Marie?
Yeah, Maurice?
Okay. Tight doesn't mean pure, it means tense. Truth or lie? No.
Myth?
Tight doesn't mean?
Tight doesn't mean pure, it means tense.
I think,
Tight can mean a lot of things, but it definitely doesn't mean pure.
yeah.
Absolutely. So it's a myth.
And I think
It's a truth.
It's a truth.
It's a truth, yes.
I think the converse as well, like if you're loose, it doesn't, or your
Yes.
vagina is not tight, doesn't mean that
you're
you are
impure.
morally loose, right? Yeah. So vaginas, like people, come in different shapes, not shapes so much, but in different strengths and weaknesses.
But also shapes and sizes.
Vulnerable shapes and sizes?
Yeah. So definitely, I think we can agree that that's a truth.
People don't speak enough about their pelvic floor, and they don't understand that a pelvic floor is muscles and nerves and blood supply all mixed together
And
in one.
connective tissue.
If you were to have an injury or a surgery on your knee or your shoulder, you'd have rehabilitation, you'd get good mobility, you'd make sure there's no muscle spasms or trigger points, but exactly the same things can happen in the vagina.
Yeah.
If the vagina muscles are in spasm, and we sometimes can call that vaginismus, that needs a pelvic floor physio to help your body to understand that different things like a tampon, like having penetrative sex, like having a gynae examination, those aren't negative things for your body to tense up and be afraid of. But making you feel bad or shameful for that, that's definitely not going to fix it.
Yep.
Cool.
Let's see, which one do I want?
Oh, bang! Technical director.
The one I wanted. Okay, let's try
Draw
again.
again.
Let me try from this side. Okay. Ooh, I should eat for 2 when I'm pregnant. Myth or fact?
If you want postpartum to be hell. Yes. So that is a myth.
It's a myth. You do not have to eat for 2 when you're pregnant. You stick to your normal healthy diet. So putting on excessive weight in your pregnancy is not healthy. It puts you at risk for diseases of lifestyle during your pregnancy, like diabetes, like hypertension, an overgrown baby, which can make your delivery difficult, can make your rehabilitation once you have given birth difficult as well. So no, you should not be eating for 2 when you're pregnant. Also, like during your pregnancy, I don't know with you guys, I had food aversion like for the first trimester where I was actually just not interested in eating a lot. I still can't take the smell of chicken. Raw chicken makes me gnar. But no, so we're going to say that this one is a myth.
Yeah. But I just want to add a caveat to that we know what's in the literature in terms of the average weight gain in pregnancy is about 12 kgs. So you will gain weight in pregnancy.
Yes.
Just what we're saying here is more the deliberate eating, overeating is not necessary. You don't have to then, once you find out you're pregnant, start changing your diet to increase your calories. That's not something you must do. You must continue to eat a variety in your diet so you have everything that you need. And you may gain 10 kgs, you may gain 30 kgs. That depends. And as much as you have cravings, you can feed them, but also be mindful about what are you putting in your body. It's it's the 9 months, and if it's going to be 9 months of putting in processed food after processed food because it's a craving, that's not good for you, and that is not adding nutrition to the baby.
No,
that is just eating a lot of high sugar, high fat, high salt content. So you can have cravings, but you also have to be mindful about what you're putting in your body.
Can we talk
And
about
the baby doesn't know McDonald's, so don't give the baby McDonald's.
It also brings up this thing of like, what can you eat and what can't you eat, like in your pregnancy. So people will be like, oh, you can't have sushi when you're pregnant, and you can't have like what else do we get?
Cold cuts,
Soft cheeses,
soft cheeses, So again, like, true, not true.
So
There's concepts behind it.
Yes.
If you understand the concept, instead of cutting off a specific actual food, that's probably more helpful to make decisions. Your immune system has to drop for you to not attack your own baby. It becomes much easier for you to catch infections. It also means you can't fight an infection if you get it, and a baby's a lot more sensitive than an adult. So if you're going to consume things that are raw, things that aren't clean, things that haven't been pasteurized, there's a much higher chance of you catching something that can be harmful. But if someone might make something to say like, you can't eat pineapple when you're pregnant, well, no, that's absolutely incorrect. Some of these came from old wives' tales or were just made up and became viral. It's best to ask your doctor, ask your gynae, and have an understanding of why you can or can't eat something.
Yeah, I always just warn them, like, obviously, that uncooked food or uncooked meat can contain bacteria. So if you are really dying, you can have tempura. If you really now like your polony, rather fry it, because it's
Just
not
to make
so long
sure.
ago we had a whole
Outbreak
outbreak of
of
listeria, and that was catastrophic. So we can never predict when such things are going to happen. And I mean, but we must understand as well, cutting out complete foods for some people may mean that then they go
They don't
hungry,
eat food.
you know.
Exactly.
So, like what Dr. Subrian is saying, we should try and incorporate like a healthy, balanced diet and know exactly why we're doing certain things.
I read the other day that you should, once you start eating something, you should rather not stop eating when you get pregnant. You should carry on during your pregnancy. Is that a true thing?
Like what?
It depends.
Anything. Say, for example, sushi. It's controversial to eat sushi. Should I
But that's
stop?
the thing with the
Should I stop or
sushi. The
not stop?
sushi is the risk of possible
Infection,
listeria,
yeah.
and then fish can contain mercury. But most of the fish that we consume is safe. It doesn't contain that large amount of mercury that can have a harmful effect on the baby. Not that sushi specifically has an issue with pregnancy.
It's for me, when I counsel my patients, it's a risk-benefit ratio, right?
Yeah.
You pregnant for 9 months with this your precious baby that you want to bring earthside. And if we're saying that there's a danger, a potential danger, then you must risk the benefit. You must decide balance the risk and the benefit. Must you eat sushi that badly? The chances are you will not get anything. That's the reality. The chances are nothing is going to happen to you. However, if something does happen to you, is it worth it? And that's why, if it's just something I really
Once in a
feel
while.
like having, it's not worth
okay.
it.
Yeah.
Skip it, you'll be fine. Find something else. But if it's a situation where there's nothing else to eat in the house, then that's a different story. Then the risk-benefit ratio is completely different because it's not about wants, it's about needs. Most of the things are about wants. And when it's about wants, unfortunately, is a time to sacrifice because it's the same with alcohol, right? You could drink a glass here, a glass there, it's not going to do anything, right? But then if you continue drinking, you get fetal alcohol syndrome.
Was it
So none of that is a want versus a need. And when you balancing wants and needs, then it's getting very sick and potentially losing this pregnancy over my craving for sushi. That's your decision to make. All I can do is give you the risks. Ultimately, the consequences will be on you. You will lose your baby, not me. And if that sushi was worth it, maybe then for you, then it was worth it. Then I say nothing. So yeah.
But there are some absolute no's, like you said. Alcohol, yes, maybe like once, twice in your pregnancy is not going to cause a catastrophic thing, but we would probably say definitively
It's an
no.
absolute no.
Yeah.
Smoking is an absolute no. Like
Any form of smoking.
any form of smoking, vaping, ooh, guys, and hubbly, guys.
That's still smoking.
If I ask you if you smoke and you say no, but I smoke hubbly
That's
when I go
smoking.
out. You smoking, baby girl. You smoking.
And where you're going when you're pregnant, smoking hubbly.
Yeah.
Yep.
Are you not on TikTok?
And vaping.
And vaping. So we can say like there are like certain things that we're just gonna say emphatically is a no. Okay. Let's carry on.
Cool. Is it me again?
Go for it.
We'll do 2 rounds.
Alrighty, this one is about vaginal hygiene. Fact or myth? Vaginal douches are necessary.
No.
Oh. And
Get rid of those things forever.
and the choir said
No.
No.
no. So the vagina cleans itself, right?
Yes.
Like, yeah, the vagina cleans itself, so it doesn't need to be cleaned with any special syrups, soaps, washes, or any of those things. And even your vulva on the outside, it really requires just real gentle, minimal effort, right? Warm water, and that's it. Like, yeah.
As gentle as you would clean your face, I would say. I mean, you don't go scrubbing your face with harsh things.
Yeah.
So treat your genitals the same. And also, having discharge in the vagina is as normal as having saliva in the tongue.
Absolutely.
Yay!
Yes. What are you trying to get rid of?
Amen!
These lips are like those lips. Yes.
Cheers, girl!
That was good.
I like that.
So we shouldn't try and wash it away or clean it away. Like obviously, every woman knows
What's normal.
what's normal. So what the color of the discharge is and how it smells like. And obviously, if it's a change or deviation from that, then you should seek medical attention and not just try and scrub it away with all sorts of things.
Yeah.
You know, when you're scrubbing away, it's the concept of a bomb going off. You're killing the good guys and the bad guys all in one. And it takes a long time to replace your vaginal biome, to create your vaginal biome. even taking antibiotics are doing the same kind of thing. But a douche is just a massive bomb all in one go.
I think another thing people don't realize is that a vagina smells.
She's not supposed to smell like roses. She must smell like a vagina.
It's not a bad
smell.
smell,
It's a
but it
vagina
has
smell.
a
An
smell.
odor.
And the smell is a vagina smell. And leave it to be a vagina smell. Right? It is not a strawberry smell.
Nope.
It's not a rose
Nope.
smell. It's a vagina smell.
Oh, that's a lie. That's a myth.
Pineapple doesn't affect the smell of
No, it does not. But still eat your pineapple.
And you should not be looking to replace that smell.
Yeah.
Right? So this whole thing of no, let me use scented this and that, no, it has a smell and that smell will be there and that smell is normal.
My favorite thing to do when patients like complain about a discharge and there isn't one is like to go like this, and I'll be like,
Do you smell?
you see,
If you have to bring it
if I
that
breathe,
close,
if I have to come to
definitely
here
not
and
smell.
it's not making me like, retract, it's normal. It's normal. And I think that also makes them feel better because they're like, okay, no, fine. Then it's
Yeah.
not that.
Maybe I'm overreacting.
Yeah. But if you're not sure, check it out.
For sure.
So
Okay.
no douching.
Okay. Okay,
Let
fine.
me bring them like this. Okay? I hope you don't hit a blank.
Okay, you can date a pregnancy with a quantitative beta HCG, which is the blood test that we check for the level of hormone in your blood. Can you tell how far pregnant I am, Dogotela? Because there were 2 guys and I don't know. Is it 2 weeks? No. Is it 5 weeks? I don't know. Dogotela, take the blood. Can you?
No.
I think this is like possibly the thing that frustrates me the absolute most is when people bring like quantitative beta HCGs. Doctors and patients alike do it, and it has its role, right? It has its role in obstetrics. It has its role in the first trimester in early pregnancies where you're trying to like figure things out. But emphatically, no, you do not date a pregnancy with a quantitative beta HCG. Those ranges overlap. So its place in obstetrics is if you have a pregnancy of unknown location, so meaning you've come in for whatever reason, we've scanned you and the womb is empty. Now we're not sure, is this an early pregnancy? Is it a ectopic pregnancy? Is it a miscarriage or something? We can do a quantitative. There is a specific level that, by which we should be able to see something on the
Something
Yes.
also. It doesn't mean anything.
Not
just
a baby.
Something.
Yes.
Yeah. And if by that level we don't see anything, then we can maybe start thinking about things like ectopic pregnancies. And then in Halima's, Dr. Aday's speciality, it's used as a treatment marker.
If you've got a molar pregnancy.
Yeah, so
Yes.
a molar pregnancy is sort of like a cancer of the pregnancy in layman's terms. So then you use it to track your treatments and also to make diagnoses, right?
Yeah.
Suspicion of diagnostics.
Suspicious diagnostic, and once you've given the chemotherapy and you're monitoring afterwards, that's how you'd monitor.
So those are when you use
recurrence.
quantitative beta HCGs. You date your pregnancy with your last menstrual period if you have a regular period, and preferably an early ultrasound. So that's an ultrasound done before 24 weeks, preferably also in the first trimester because that's when it's most accurate.
Yeah.
But
I want
please-
to add in one more thing about that. There are a lot of ladies that come in with the beta HCG results. Maybe the casualty did it, maybe the GP did it, and they have an idea that means there is a living baby inside of them. And all that means is the pregnancy hormone in your body is up, but we've still got to do a scan to find out if there is actually a baby growing inside. Can it be a cancerous pregnancy? Have you already miscarried? But the levels, is it a tumor? It can be a lot of different things. It doesn't just mean that you're pregnant if that hormone level is up.
It's true.
Yeah.
True.
Cool.
Next one.
Yeah.
Okay. Oh, this is good. Pulling out isn't a plan. It's a gamble. I like it. Guys,
True.
Absolutely. Absolutely.
True.
Guys, no, please. Pulling out is just
Love this
pulling out is
world.
playing
Otherwise
games.
we wouldn't have a job.
Yes.
Keep doing that.
Yes.
Guys, do better. It's 2025. Yeah, do
But
better.
on a serious note, I think we need to address
Contraception.
reliable contraception.
Yeah.
And pull-out method is not even mentioned in any of the things
At
that
all.
we discuss when speaking about contraception.
No.
Yeah.
So I don't know.
I think if there's a situation where you are forced to have pulling out be your only option in that sexual experience, then you've got to move towards emergency contraception as soon as possible as you can. So within hours, as soon as possible after the sexual event is when it's most effective, but even up to 5 days later, best though within 72 hours. But it's not to make pulling out common. But if it does happen, it doesn't mean that there are zero options. Emergency contraception is your option.
And if it's happening like regularly, like if you are in a relationship or situationship and this is, you know, a regular occurrence, then it's time to consider, like Dr. Messina saying, some reliable contraception. And also, guys, barrier methods are some bliff. Like barrier methods is your only protection against STDs. Pregnancies, like Dr. Sobrani is saying, like use emergency contraceptions. There are TOP facilities, but once you have HIV, it's yours for life. So please, like barrier methods. And we have in this country both male and female forms.
And also there could be live sperm in like the semen.
Absolutely.
That comes, they call it pre-cum.
Yep.
So that fluid that comes before, there could be live sperm. So you may actually miss the opportunity
Yes.
to, you know.
Yeah.
Yeah. If you tell me you've pulled out, I write planned pregnancy. Planning.
Yes.
If you're not doing anything
Yes.
to stop it, you are planning. That's how you must look at it. If you're not doing anything reliable to stop it, you're actually planning a pregnancy.
Yeah.
And if you're not happy with what that sounds like, then do something that's going to be more reliable.
If it feels uncomfortable to discuss contraception with the person you're having sex with, then maybe you shouldn't be having sex with that person.
Yeah.
That's also very true. That is a truth.
Facts.
Okay,
Last one.
last one. Okay, let's see. Ooh! The G spot is a real
Wow.
bow chicka bow bow. All right, the G spot is a real thing.
Where
Anyone
is the G spot?
want to ask some people in the room?
Well, ask Dr. Sobran.
Let's ask Dr.
So that is actually a complicated question because in simple terms, the concept of a G-spot, an area of increased pleasure in a woman's body, that does exist.
Yes.
But for that to simply be an exact spot that you can pinpoint, no, that doesn't exist. It's a combination of tissue in the vagina. It's towards the front of the vagina, about 2 centimeters in. But for certain ladies, that can be deeper in or further out. For some ladies, it can be such a strong sensation that feels like pain. And what is supposed to have a certain sensation for you feels completely different. That area is a mixture of blood vessels, connective tissue, nerves. It's just the opposite side of the clitoris. But you're touching it from the vaginal side instead of from the outside of the body.
So if you put it under a microscope, you cannot identify that this is
You
the histology of the G-spot as compared to saying...
We
taking
don't
a
have
piece of-
microscopes in the
No, but I'm
bedroom.
just saying, like taking a piece of tissue from the posterior vaginal wall, you would identify that this one is coming from...
You
the
can
G-spot.
identify different tissue if you put it under a microscope. But for the majority of ladies, finding an exact spot or an exact way to create a positive, pleasurable experience from that exact location, it'll vary a lot.
Could you train other parts of your vagina to be a G-spot? Like, could you, with like foreplay and intimacy, as we've discussed it here, and having conversations with your partner and telling him or her, this is what I like, this is how I get revved up. Could I train then like other parts of the vagina to then become a G-spot?
Probably the more important question is, how do you want to enjoy sex instead of trying to turn this part of the vagina or that part of the vulva into something to have an orgasm? It's probably better to find out with you and your partner, or even through masturbation or porn, what feels good to you. Some women enjoy stimulation on their urethra, that's the urine opening. Some prefer to be on the vulva because it's too intense on the clitoris. Others think that they're going to have an orgasm just with vaginal penetration, but 80% of women are not going to orgasm just from vaginal penetration. Don't worry about where the G-spot is. Worry about what works for you and how you can explain that to your partner in a way that it can be done during sex.
I am pulling yours.
Pull out game stronger.
Okay. All right. Okay. I like this question. HPV infection means your partner is cheating. Huh? I've come to my appointment at a pap smear. They tell me about HPV. And I know I haven't been doing anything. So this man must answer. So, Doc, is he cheating?
Well, I don't know you man like that. I would say it's a myth. No, like
No one knows where
When
you've
you
contracted
acquired
something.
GS.
Yeah.
And it can even lie dormant for years and then show up later.
exactly. And the other part of that is people will be like, but I had a pap smear before and I didn't have this HPV.
I
Why
think that's
why am I finding it now?
That is the key to that. So HPV testing has always, so okay, if we're talking about cervical cancer or screening for cervical cancer, we take a smear, right, which is just a small brush that we use, and we open up the vagina to see the cervix, which is the mouth of the womb. We take a smear and then we send that to the lab. Now, which test you send it for is where the difference is. What we used to do is send it away for what we call cytology, where they look at the cells, right? We're looking for whether these cells are cancerous or they're very abnormal or they're normal. And then you get a result telling you that no, your cells are normal, your cells are abnormal, or your cells are suspicious for cancer. That's what we used to do. So now we know that HPV, which is human papillomavirus, not HIV, is an infection that almost everybody will get when you have sex. Even if you use a condom, because it's also skin to skin, right? You will get that infection. Most people get it when they start having sex, and eventually your body will clear that infection because it's a virus. And normally viruses, your body sorts them out, right? So now, knowing that if you have that infection and your body doesn't clear it, it then causes the cells to be abnormal. So remember, we were testing the cells. Now we went and said, why test the cells instead of saying that, let's not check if the person has HPV.
Yeah.
And there's different types of HPV, many, right? There's some that are high risk and can cause cancer, and some that don't really cause cancer. So we know the high risk ones. And if we know you have a high risk HPV, then we already know you have a risk. So now we have changed from looking at the abnormal cells to looking whether you have the thing that causes it. Because if you don't have HPV, then you're unlikely to get cervical cancer.
Yes.
Right? So that's what we're doing now. It's more accurate versus somebody looking where you can see something that looks abnormal and you can say it looks normal. Now it's whether the virus is there or not. So it's more accurate. That's what we're doing. So if you had a normal pap smear 5 years ago, we were not doing HPV. You could have had HPV at that time. Now we're doing HPV testing and you are found to have HPV. When did you get it? I don't know.
None of us.
You can
can't
have
tell.
HPV
For
sitting
years.
there for 10 years, for 20 years. You could be someone that doesn't clear it. And whether you don't clear it and get cancer, you cannot clear it and not get cancer. You cannot clear it and get cancer. But when you get it, how long you've had it, we don't have a test for that. So the short answer is that we cannot answer whether your partner is cheating on you or not. That, unfortunately, is for you to answer.
Yeah.
And if you have a suspicion, then you have a suspicion.
Exactly.
Okay, cool. One last one, ladies?
Okay.
All right. Okay, seems that we've got a theme going here. Is cervical cancer is a genetic disease? Myth or fact?
Myth.
Myth.
Definitely a myth.
Definitely a myth. And I think it goes back to what you've just
Yes.
Yeah.
said.
Exactly.
You've explained it so well.
It's
Like
If it's
more
caused by
than
a virus,
99% of
you
it
don't
is
have a
caused
virus
by-
running in your family.
No. No.
That's the simple answer, right?
Yes.
Yeah.
We have genes that run in the family. It's not caused
It's not
by
a
a
genetic.
defective gene. It's caused by a virus. So your mom did not have the same virus and then pass it on to you. If your mom had HPV when you delivered, because then you might think, okay, maybe she had it and then she delivered me through. No.
Sure, yeah, no. That's
She
not
didn't
like
deliver
that.
it into your cervix. So no.
That's
Simple
not like
answer
that.
is it's not genetic.
Okay. Cool. Excellent.
Yeah.
So,
So that brings us to the end of this game. It was fun, ladies.
Yeah.
Yes, I enjoyed this.
Okay, girls. The next one is called Gynae Golden Rules. Okay, so the way this game works is I've got on these cards sentences with like words left out of it. And, you know, by being the virtue of being gynaes, these are things we live by. So I'm going to read the sentence and I'm going to bleep like the blanks and then you guys fill in the missing words. Okay. All right. Let's test your gynaes. Okay, so every woman is pregnant. And every pregnant woman is bleep until proven otherwise. Or every pregnant woman has a bleep until proven otherwise.
and the topic? Until proven
Oh, okay.
I think for
Okay.
safety reasons.
Right.
So,
Okay.
yeah. So interns and commsubs, you guys are going to be in the bush and working like, you know, we've said with minimal supervision. If you see a woman, do a pregnancy test because every woman is pregnant.
Until proven otherwise.
And if she's pregnant, until you've seen the baby in the uterus
Yeah.
It's an
and
ectopic.
both her adnexa are clear, because they're things like heterotopics.
Very rare, but yeah.
Yeah, so until you've actually confirmed that the pregnancy is located in the uterus, she's got an ectopic until proven otherwise. If you do that,
And
you
you
should...
cannot diagnose a threatened miscarriage if you haven't seen the
fetal
baby
heart.
inside.
Or
Okay.
complete.
Okay, number 2. Menopause is after bleep of no menstruation.
1 year. Yep.
Okay?
12 months, yes.
All right. This one is like a Dr. Isaac's special. A normal HB does not exclude.
Anemia.
Iron deficiency.
Okay. Okay, this one is also probably a Dr. Isaac's one. Breast is best, but fed is
Better.
yes. Breast is best, but fed is better. So if you're struggling and you find that breastfeeding is impacting negatively on your mental health, then feed the baby whichever way you know gets the baby fed. And if that means that you have to top up with formula, stop breastfeeding, pump and express milk, as long as the baby's fed and the mom is mentally stable, that's all we really can ask for. Okay, this one I like. The what is a self-cleaning oven?
The
Vagina.
One more time, the vagina is a
Self-cleaning oven.
All right. Okay. This one says bleep, lubricants are better. I think this one is for Dr. Soprano.
All lubricants are better.
Water-based though.
Any lubricant is better. I like silicone lubricants are better.
Okay.
I like that. All lubricants are better.
All lubricants are better.
Then saliva.
Okay, I was going to be facetious, but I'm not going to. We're on a time budget. Okay. This one, let's see. This one you can give your own take. You should see your gynae leap.
More than you think you should.
Yeah.
Don't come see me when there's a problem. Come see
Me before it's a problem so we can prevent it and discuss.
I like that one.
Yeah.
Often, regularly.
Often, yeah.
Regularly.
Like,
But I like
Like
that more often than you actually think. People will be
I
like,
always say, I think it's like being a dentist. I mean, go for a checkup when there's no problem.
Yeah.
So same with your gynae. Just want to make sure I'm okay.
okay. This one, Antibiotics are bleep in pregnancy.
Lifesavers.
Allowed.
Thank you. Louder.
Please.
Yeah, lifesavers.
Okay. And then, okay, I don't know, this one might be a little bit confusing, but this is the last one.
Okay.
You should not bleed for longer than,
7 days. Your period.
shouldn't be longer than 7 days. And also, guys, you shouldn't be dying of menstruation. Like if your menstrual cycle is making you sick, is making you not function, you're not able to go to school, you're not able to go to the shops, you can't go to work, you've used up all your sick days because you have a menstrual cycle, that's not normal.
Just because your mum and your sister had the same bad periods as you doesn't mean that it's okay.
Yeah, yeah. 2 wrongs don't make a right.
Yeah.
Okay, that's all right.
So our next segment, we're gonna play What's in the Box.
What's in
okay?
the box?
So we're gonna fish out items and then we have to guess what it is and explain what it does.
Okay.
Cool. Who's gonna go first?
You.
Okay.
What's in the box? Okay. So we're all like closing.
Okay. Can't look.
Ooh, let me not cheat.
Ooh, okay. I have
Nice.
an intrauterine device. I
Okay.
think this one is the Kylina because it's a little bit, the color is green. It's not a Mirena.
Are we guessing or are you telling us what's happening?
Oh, what are we supposed to do?
I opened my eyes. Everybody's eyes are closed.
What are we supposed to do?
Yes. Okay. So we guess that it's a Kylina or a Mirena, but it's an intrauterine device.
It's an intrauterine device.
Yes. Okay. So what does it do?
Okay, so an intrauterine device, it's a contraceptive device. This one is loaded with hormones. So the advantage of them being loaded with hormones is that it can reduce heavy menstrual bleeding. So it's licensed for that. It's long acting, it's reversible. So that's the other nice thing. It's a plug and play. So you're good for 5 years. And yeah, there's like a few kinds. I think there's about 3 kinds. This one is the Kylina, which is a little bit thinner in diameter compared to the Mirena, so it can be used in non-parous uteruses or people who haven't given birth before. Anything else to add?
I want to add in something. A lot of people don't know that Mirenas can also be used to help you in menopause. So with perimenopause, there's a lot of irregular bleeding and heavy bleeding. You might not necessarily want to take a contraceptive tablet anymore, or maybe you're not even healthy enough to qualify for it.
So those can really help with the bleeding abnormalities as you're getting towards menopause. And it can even be part of menopause hormone therapy.
Yes.
Okay. Cool.
So I've got something that is soft but firm.
Okay.
It's got a curve to it, slightly pointed at the tip, but not sharp.
What on earth?
It is about 10 centimeters
Show us
long.
that high and how.
It's this long with a curve.
Yeah, I know what it is.
And like I said, it's smooth but firm. And it feels pleasurable.
Are we guessing?
What does
I have
it sound
no
like?
idea what that is. Doesn't sound like something in my gynae rooms.
It sounds like something that should be in your
Hey, oh.
Shall we bring it out? Let's see what it is.
What are your guesses?
My guess is it's a... Is it a dildo?
Or
That's what I'm thinking.
Okay.
it feels like a vibrator.
Okay.
So this is a vibrator, right? It's firm
That's cute.
but smooth,
Yep.
curved with the tip but not hard. And if you press here, it moves, but the battery is off.
Oh, okay.
Okay, so this is an example of a vibrator that they come in many different shapes and sizes to your fit, to your liking. Can be used alone or with your partner, and is there to help you intensify or enhance your sexual experience.
Okay. It's very cute.
Very cute and portable.
Let me see. Can I I was gonna say, can I fit in my scrap pocket? In my scrap pocket. Okay. Lonely calls.
So we
It
like
feels nice.
it feels very nice.
Like smooth.
Yeah.
Feels comfortable. I don't know if you wanna-
Ladies, please make sure that you have good sex toy cleaners from wherever you buy your sex toys. They'll also be able to have the proper cleaners that you can buy and how to store them. You can give yourself infections if you're not keeping them clean. It doesn't mean that the sexual aid is the problem. Like anything, if you're not cleaning your mug, that can also create the same problem.
Cool.
Cool.
All right. Maurice.
Do we keep the ones we get?
Yours. Okay.
Can be a gift from ziRight, girl.
Anything. Ooh. Okay. I feel. This is plasticky
Plasticky. Okay.
and noisy.
Okay.
Does it quack like a duck?
I can't hold it completely in my hand. It's a little bit bigger than my hand.
Okay.
And it's narrow and smooth on the one side. And it's a little bit bigger on the opposite side with a hole going all the way through it. What?
Sounds
like
a speculum.
Yep. So speculum.
It's a speculum. All right.
So speculums are used for a lot of things in a gynae practice. Most ladies think that the only time that this gets used is for performing a pap smear, which is the screening that we do for cervical cancer. But a speculum is also really helpful for your doctor to look inside and see what your vaginal walls look like. Are they looking older from lack of estrogen, which can be menopause, it can be from medications you've taken, even if you're breastfeeding and postpartum. It can help us to look for genital warts, help us look for tumors. We can get a good look at the cervix. Sometimes we also want to see if there's bleeding, where that bleeding is coming from.
Originating from, yeah.
Okay, and this can help us to get a good view all the way to the back of the room instead of just looking at the front door and assuming what's going on deep in the house.
Yep.
Okay.
Cool.
This one is a plastic one, so it's disposable. That helps it to be more hygienic because we use it once and we dispose it.
But they can also be metal ones that are sterilized and then reused.
Cool. What's in the box? What's in the box? Oh, wait. Not much left in this box. Okay. Ooh, how do I describe this? Okay, this one has a circle on one end, and then it has almost like a finger-like projection coming out from the middle, and then it has a little knob at the end again.
A knob.
a circle,
A circle and a
finger-like projection
and a knob.
and a knob.
Yeah.
Is it a
Oh, pessary.
It is. My trusty little gel horn. Okay, so this is one of many different types of pessaries. And we use these usually like when they are pelvic organ prolapse. So that means when the organs, your internal organs, start to descend or sag and protrude. So this one in particular works with a suction, creates a suction. So you put it in like this. That was your vagina. It goes in like that. And then you twist it until it makes a little suction so that it holds whatever it needs to hold in place. They come in different sizes. This one is particularly my favorite because I get the best
Seal.
with this, and I have less patients, complaining that it falls out. Yeah, but they come in different varieties, different shapes, different sizes, and they have to fit to your comfort. So it's not, again, like all things in gynae, it's not
Not an exact science as well of how you can measure to fit the pessary. You must try and get the biggest one that's more comfortable for the patient. But still does the job.
And that one is for someone who's not sexually active.
Yeah, no, you can't. You'll be fighting.
Yes.
But there are pessaries for people who are sexually active.
Also, with the pessary, a lot of people think, oh, it's so dirty, I can't leave something inside of me. But your vagina is not really so different to your mouth, and we have braces inside, dentures, bridges, so it's treated exactly the same way.
Okay, cool.
Yeah.
Are there more?
There's more. Oh, okay. Now I'm gonna do it right this time.
Yeah, let's give her a
I
chance to
already
do it
started
right.
wrong. Okay, cylindrical. Also about 10 centimeters long.
Okay.
Okay.
Makes a noise.
A noise.
That sounds like liquid.
Like a gurgling noise, yeah.
Sounds like liquid.
Yeah.
Okay.
A liquid in a cylinder.
Is
Like
it,
a bottle? No.
Yeah,
A liquid in a
bottle.
cylinder.
Lubricant.
bottle?
is it bubble bath?
Possibly.
We hope not. It's supposed to
Take
be
it out now?
take it out.
Yay!
Lubricant.
Lube. Okay.
So this one
We love
is,
lube.
Yes.
It's a silicone lube, so long-lasting silicone lube. Like we explained, that lube is better than no lube at all. So you can use silicone, you can use water-based, preferably non-perfumed or no sugary
Content.
lubricant, because then it disturbs your vaginal microbiome. And you can use it to insert pessaries, you can use it during intercourse, you can use it to pleasure yourself. There you go.
There was something I wanted to say about lube and I forgot. It just slid out of my head. There's something I wanted to say about lube. Oh, oil-based lubes. Yeah. So if you're using condoms, condoms and oil-based lubes don't go together. So just be careful if you are using lubes for intercourse and you are going to use a barrier contraceptive, then preferably not an oil-based lube.
And I definitely prefer silicone lubes to water-based lubes because they last longer. You're going to get evaporation if it's water-based. And so then you're having to stop and start again, and you're getting drier when you were just starting to enjoy it. A silicone lube will last for as long as you want it to last until you wash or wipe it away.
Okay. That's good to know. Is there more in the box?
There's more in the box.
There's more in the box. Ooh.
The look on your face right now.
When your gynae pulls that
What is this?
Describe it.
Okay. This is a cylindrical something
A cylinder.
that has a plunge sort of mechanism at the back, right? That goes in and out.
A syringe. Plunge.
Similar concept, but it's not. With a brush on the end.
Halima, this one is for you. I put that one in for you.
I think, is it not the HPV self-examining brush?
Kit? Yes. Yay!
So this is exciting.
Yeah.
This is exciting stuff. So
It's missing a lid because my 2-year-old stole it.
It should come closed.
Yeah.
So this is actually, we were talking about pap smears earlier on, and I said we use a brush to exact. So this is not the brush that we normally use, but the concept is the same. The difference is that this you can do yourself. So the same way you'd have a tampon that you put that has an applicator, you would put this in the vagina, push the applicator through, smear it around, and then push it back, close it, and send it to the lab. So the nice thing about HPV testing is that unlike the cervical smear where you're testing the cells, you need to get specific cells for you to know that you've done the correct test. And by getting those cells, you need to visualize the cervix so that you know you're going where you need to go. But with HPV being a virus, it can be anywhere in the vagina, on the cervix. It's not specific, so you don't have to exactly know where you're inserting this. So it can be done blind, what we call done blindly, i.e., you don't have to first put a speculum in and directly go to the cervix. So this is something that's new and coming up in terms of adding to our screening, because we have a lot of patients who don't come or are shy to come. Maybe you're in a town where there's only a male gynae and you don't feel comfortable with a male, and going to a female gynae is going to be very difficult for you. The lab will give you this, you test and you give it back to them, and you will have cervical screening either way.
Yeah,
that's exciting.
And medical aids pay for them too. So there's no reason for you to feel that if you're not going to the gynae for your screening, that you have to pay out of pocket for that.
Lovely stuff. Is there still something in the box?
There is.
Oh.
This is Pandora's box.
Oh, okay. All right. This is circular
Okay.
and firm. And those are all the good words to say about it. It's a disc.
Okay.
Okay, disc shaped. I know what this is because I rest my coffee on it at my desk.
It's a coaster.
It's a coaster, but it's more than just a coaster. Hey, does anybody know what it is?
I don't know what you call it, but like it's the thing that you use to demonstrate how the
That-
intrauterine
yeah.
device.
It's our little practicing fake uterus.
Yeah.
So this comes
show
with
how it
the
goes.
intrauterine devices, so that you can be able to use it for learning to either to know how to insert it, so you can practice to not push too firmly or push too far for inserting, but also to explain to the patients what
it
to
looks like.
expect for the process. Sometimes if they're seeing something this big, or the box for the Mirena or Kylina is covering half the table, they're very intimidated. But if you can show them just how small the device is, if you can show them how easy it is to insert it in, it makes the experience a lot more calming. So we're here.
Okay. So also important, like about these things, like you were saying, like it's good for showing patients like what it looks like, what to expect when you're putting it in. But can we please just talk about pain management when putting in these devices? I've usually likened it when I tell my patients it is quite uncomfortable. It's actually quite painful if it's not managed properly. So grabbing the cervix with a Valsalem and just shoving this in like with no pain management, that is and should not be the norm anymore. No. So it requires adequate, like good analgesia. It requires you to be relaxed and not anxious, and we can talk about how we get around that. And obviously like good patient selection, right? And in where you're going to do it can be done in your rooms. Usually for myself, if I do it in my rooms, I would require my patient to at least have given normal vaginal delivery at least once or twice. If you are someone who have had seizures or you've never given birth before and you are quite anxious and tense, then you might want to consider doing it under some sort of anesthesia, whether it's conscious sedation or going to theater, because dilating your cervix is labor, right? And so it paramounts to that amount of pain. So yeah, there has to be good analgesia when you're putting in an IUCD.
Yeah. We don't ask anybody else to have surgical procedures without painkillers.
Yeah.
But inserting this into your womb, that is a surgical procedure. We're putting something into your body. You should be given the right kind of pain control.
Yeah. Okay. Is there still something in that box?
It is.
What is in this box?
I know, it's never ending.
It's Pandora's box. I don't.
Oh, it's always me. Oh no, wait, yes, there's two more things. Okay. All right. As you can hear, it's making a noise. I'm rubbing two of them together.
Chip packet.
I mean, some people might
Maybe.
consider it sweets. Inside is a very slippery circular thing. If I squeeze the packets, I'm feeling like there's something that's circular inside that like moves out of the vein very easily. I know I use this in my practice every day. It can be used in your gynae office and it can be used at home. What am I?
It's a condom.
Okay. It's a condom. Yes.
Strawberry flavor.
Strawberry flavored, brought to you by your national government. So yes, we use these all the time. I had a patient once come and for a gynae visit, and her partner was with her husband, and so they were in the room, and I was about to do the transvaginal ultrasound, and he saw a whole bunch of these sitting on my desk, and he was like, "But don't you look after pregnant women? Like, what's the point of having condoms if they're already pregnant?" And then I was like, "Sir, I can't put this in your wife and then in the next woman and the next woman." So for hygiene purposes, we use this to cover our transvaginal probes. But over and above that, like I was speaking about barrier contraceptives before, this is the only type of contraceptive that will prevent STDs. So yeah, very important. Very important. Okay, I think
Awesome.
You're
Oh, we
done.
still have.
there's one more.
Okay.
Can't find it. Okay. It's again circular.
A lot of circles in gynae.
Feels like there's a membrane or a thinner sheath in the middle. It is, what's a simple word for pliable?
Pliable.
The same word.
It's pliable. Yeah, you can fold it and manipulate it and squeeze it.
Female
Firm on
condom?
the outside.
That's a good guess. Female condom?
Don't think so.
Oh.
I don't know.
Is it a menstrual cup?
Ooh, yo, but that was a nice one.
No,
Not a menstrual cup?
not a menstrual cup. One more try.
A menstrual disc? No, we're not even in that
The
vicinity.
Discord, it has like a
Another pessary.
sheath. Yes. So this is another pessary. What is this one called?
Donut.
No,
It's not a
it's not a
donut.
donut. This one. This is like a ring with a
With a shelf.
sheath or a shaft. Yeah. But yeah, it's again used for prolapse and also comes in different sizes and it's inserted in the vagina. You squeeze it like this, push it in, and then it will also pop and prop up whatever is falling.
Excellent.
Great.
Okay. There you have it, guys. That's a wrap in this special episode of ziRight Girls. We had our first roundtable discussion. I'd like to thank all the ladies who've made themselves available to come and have this special talk with us today. So in the beginning, we learned about who was who by doing 2 truths and a lie. And then we did some Mythbusters, which we hope will help you decipher fact from fiction. Then we told you all about the gynae's golden rules, and we ended off by playing What's in the Box. And we showed you some of our tools and toys that we use in gynecological consultations. But at the end of the day, it's all about our humanity. Coming to your gynecologist is not only about big problems. We hope to see you when there are no problems and when there are small problems so that we can prevent them from becoming big problems. This episode was all about having fun and demystifying and taking the cloak off your gynecologist. We hope that you see us in a different light. Until next time, ladies, we hope that
ziRight Girls.